All right, so we're going to go over the prenatal assessment. So where I work right now, I work in an OB office, and this is what we do every day is, new patients come in with new pregnancies, and we go through the entire pregnancy with them. So I know with your simulations this week, you're going to be doing a new OB assessment, basically. So I kind of want to just walk you through that and walk you through what kind of testing we do in the office throughout the pregnancy, what kind of teaching we do, so what the nurse's responsibilities are. So the very first thing that we have to determine is what their gravida and parity is. So gravida is just how many pregnancies have they had. So when we're counting pregnancies, that's going to be full-term pregnancies, preterm pregnancies, miscarriages, abortions. That's everything. When we look at term pregnancies versus preterm pregnancies, term pregnancies are anything past the 38-week mark. So notice that it also goes 38 to 42. So typically we judge pregnancies at 40 weeks, but we will let moms go up to 42 weeks. Typically, in the medical community, they don't really like them to go much past 41 weeks. Preterm is anything between 20 and 38 weeks. So once fetuses reach that 20-week mark, that's a good sign. That means that we're on our way and we're doing really well with that pregnancy. When you hear the word abortions, a lot of women do not like that word, but we do use that word for miscarriages. So just so that you guys know, a miscarriage is, in the medical terminology, considered an abortion. So miscarriages versus therapeutic abortions kind of fall into the same realm. And then we look at live births. So you can see the beginning initials of each one of those is the GT-PAL. So I have a little quiz for you. So I want you guys to kind of try to figure out what her gravida and parity is on this one. So patient presents to the office for her new OB visit. So she's currently pregnant. She has 2 children at home. She's had 1 miscarriage. So her first kiddo was born at 39 weeks and 5 days. Her second child was born at 37 weeks, 2 days. And her miscarriage happened when she was about 8 weeks. So what's her gravida? 4, right? Because she's currently pregnant, she has the 2 kids, and she had the 1 miscarriage. So she's been pregnant 4 times. How many term pregnancies? 1. 1, because she hasn't completed, that second baby wasn't to the 38-week mark. It was prior to 38 weeks. So I know we look at 37-week babies and they look perfectly fine and they look completely term, but we do consider that preterm. All right, what's her P, her preterm? 1. What's her A? 1. And then her living children?
2.
Perfect. So you can see where that can kind of get a little bit confusing, and if you guys are confused, don't feel alone. I still have staff in my own office who I sometimes have to review this with. So just try to remember, though, that 20 to 38 weeks is the preterm, and then 38 weeks and beyond is your term, and that should help you out. All right, so I kind of just want to go over what the different prenatal tests are that we do in the office, and there are a lot of different tests, and we do them throughout the pregnancy. So within the first trimester, we do an OB panel. We test for quite a few different STDs, including HIV. We do a urine culture. There's some genetic screening that we do, and I'm going to go over all these here in a minute in a little bit more detail. When we get to the second trimester, there's some more genetic screening that we can continue to do if the mother would like to. They're not required. We do a 20-week ultrasound. We check for gestational diabetes. We talk about fetal kit counts. And then when we get to the third trimester, we always do a Group B strep screen on moms. And then the rest of those tests are kind of dependent on what's going on with the pregnancy. So we'll talk about each one of those. So first trimester, we do a full OB panel. So we check complete blood count. We're looking at the platelet counts. We're looking at her hemoglobin and hematocrit. We're also checking her blood type and her Rh factor. So we want to know if she, by chance, is Rh negative. If she does happen to be Rh negative, we need to really give her precautions on bleeding. If she has any bleeding in the pregnancy, we need to know about that, just because of the possibility of creating antibodies against an Rh-positive infant or fetus. We check for syphilis, hepatitis B, like I said, HIV, so all the different sexually transmitted infections that are possible. We also check for rubella, so that's your MMR vaccine that you may have gotten as a child. You may have had to get boosters as an adult. And then we also check urine culture on new OB patients. And the reason for that is a lot of pregnant women can have an underlying urinary tract infection and not realize it. And that can cause complications with possibility of preterm labor and contractions. It also sometimes gives us an idea of possibility of group B strep status. So some women are just natural carriers of group B strep, and we can see that in their urine sometimes. So this is the basic panel that we check right at that first new OB visit. And then there's some optional tests that we can also offer to the patients, just depending on what they want to do. So the first one is cystic fibrosis screening. Do you guys remember cystic fibrosis, what we're looking for? Okay. So the way that the cystic fibrosis screening works is it's just a blood test, and it only tests whether mom is a carrier of cystic fibrosis. So it doesn't really tell us anything about the baby at all, but it will tell us, does mom have this gene within her makeup? If it comes back and says, yes, mom does have this gene, we would then, in order to see what dad's chance or what baby's chances are of having this disorder are, we'd have to check dad as well. So we screen mom first, and then we can screen dad if mom ends up being a carrier, just to see what chances are for baby. This test only needs to be done once in the mom's lifetime. So basically, once we know her genetic makeup, we don't need to do it again. With all these other tests, we do it with each pregnancy because we're looking at that specific pregnancy and that specific fetus. This next test, I did look, and your book does kind of talk about it a little bit, is an early screen or an ultra screen. Some people call it a sequential screen. There's multiple different names for it. It's an ultrasound and a blood test combination. And what it checks for is Down syndrome, trisomy 18, trisomy 13, and neural tube defects. So this one is actually screening to see what the possibility is of baby having these different disorders. It doesn't give you a yes or no. It doesn't give you a positive, negative result, but it gives us an idea of what are the chances that baby might have this. And they base it depending on mom's age. So these used to be tests we only offered to women over the age of 35 because we know that after the age of 35, the risk of those things increases. The American College of Obstetrics and Gynecology, which is what the OB doctors go by, has come back and said we need to offer it to all women. So all women are at risk of this. We offer it to every single woman that walks in the door. So these are just some different screenings that can be offered and can be given, but are not required. One thing that I failed to mention on the first trimester, we also sometimes do gonorrhea and chlamydia testing. Part of that, it's not a required test, but it is also another one that we will test for if a mom wishes. We do see a fair amount of chlamydia, so we like to make sure that we get all that cleared up so that we don't have any issues for baby. Yes?
What did you say that the early screen or ultra screen was also called?
Sequential screening, you may hear it called. All right, you guys ready? All right, so second trimester tests, again, some of these are dependent on whether mom wants to do them again. So when we look at the first three up there, the chorionic villus sampling, amniocentesis, and quad screen, those are all, again, tests that are optional. Moms do not have to have these. Chorionic villus sampling, I will show you pictures of that here in a minute, as well as the amnio. Quad screen, that is the one that your book talks about probably a little bit more. It's a little bit more of an outdated test. We do offer it to women who don't come in until their second trimester to be seen. So if they miss that first round of testing, the sequential screen, early screen, We can offer them this if they want to still do some type of genetic testing. It's not quite as sensitive of a test, but it is out there, and it tests for about the same things. It looks at the Down syndrome risk and the neural tube defect risk. We do a 20-week ultrasound. That's where they find out the gender, and that's what most moms are excited about. That's not really what we're looking for, but that's what most parents are excited about. We do glucose challenge to check for gestational diabetes. We check another CBC at this point to check for anemia and check their platelet count. We can talk about fetal kit counts, and then if needed, we can do a 3-hour glucose test. So let's talk about each of these. So chorionic villus sampling. This is actually taking a piece of the